the sort of the debate has shifted, and now there's a great deal of discussion about what to do about the federal debt and what to do about the federal deficit. That's mainly because, and there's a lot of attention that's on Medicare, and that's mainly because Medicare is 15% of the federal budget. So as there are discussions about how do you constrain the growth in government spending, it's pretty hard to talk about it without thinking about Medicare and in some instances Medicaid. So as the next slide shows you, this is why it gets tricky for those who are focusing on federal spending reductions. Medicare is 15%, then there's Social Security, then there's defense, and you go around the pie, and it's not easy. There's not a lot of low-hanging fruit hanging around this federal budget, and because Medicare is a large share and it's projected to grow, there's a great deal of interest in policies that will constrain the growth in Medicare spending over time. So Medicare is definitely back on the table. You will be hearing about a lot of ideas in terms of different proposals. Here we have a table that kind of summarizes where some of the major proposals are. We don't know what will come out of the discussions with the Vice President over the course of the summer as he's working on the debt limit. We, almost every day, I just read about a new proposal that Senator Lieberman has proposed. There are new ideas coming out every day. But there are kind of major themes, and let me just tell you quickly. One major theme is capping the growth in Medicare spending one way or another, and we'll talk about different ways of doing that. Premium support is actually one of the ways in which that can be done. And just to sort of give you an example of premium support, that I think, as you know, because it's gotten a good deal of attention, was the proposal in the House Republican budget, Chairman Ryan's proposal. Yes, that included premium support. The President's framework for debt reduction did not have premium support. We have a big maybe on Bowles-Simpson because they mentioned it may be one of the ways in which Medicare spending could be constrained. And in the Domenici-Rivlin proposal, yes, premium support. Another idea, raising the age of eligibility. Yes, that's in the Ryan plan. No, it's not in the President's framework. Maybe it is mentioned by Bowles-Simpson as an option. No, it's not in the Domenici-Rivlin plan. There are other proposals to raise premiums directly to cover 35% of program costs instead of 25%, or restructure benefits and cost sharing. The IPAB, the Independent Payment Advisory Board, has gotten a lot of attention. Some people want to strengthen it and have it be a vehicle for greater savings. Others want to see it go away altogether. And I think you're going to hear a lot about that this summer. There are also proposals to find savings from the dually eligible population, those 9 million high spenders we talked about earlier. That's an important thing. Keep your eyes on all of these proposals, but that's an idea that states are pushing because it would be a way for states maybe to achieve some savings and the federal government to achieve some savings. And given the vulnerability of the population, on the one hand, you want to do a much better job coordinating and managing care, but on the other hand, you want to make sure people are getting the services to which they're entitled and they don't lose access to Medicare providers. There are other suggestions to get more aggressive on prescription drugs, and you see that, for example, not in the Ryan proposal, but yes in the President's framework, and yes in the other two that are there. So there are a lot of ideas that are on the table that are in the Medicare world. The biggest one, as I mentioned before, is premium support, and just very quickly, I'll give you a general feel for what this is because it has gotten so much attention. In essence, what it says is rather than entitling people on Medicare to a specific set of benefits that they have now, they're entitled to hospital, they're entitled to physician, and the law is really clear. It entitles people to, in essence, a payment, an amount of money that can be applied toward the purchase of private insurance. Now, these proposals differ in a number of different ways. There are a lot of bells and whistles, so I'm really generalizing here, and I'm thinking more about the House plan than some of the other ideas. And there are big questions. Would the traditional program exist or not? In the House plan it doesn't, but in other premium support proposals it would. How would that work with traditional Medicare competing against private employers? There are questions about would there be defined benefits or not? Would the amount of the government payment be set to hold seniors equal to where they are today or not? And how would this government payment grow over time? The Congressional Budget Office has taken a look at these premium support proposals, and this is our analysis of their analysis. So really, these are CBO numbers. What this shows you, and if you could just focus on the center column for a second, the center bar. This is in 2022 what the government would pay and what beneficiaries would pay for a 65-year-old that year. So you can see the government share is about $8,000 and the beneficiary's share is about $6,200. What the Congressional Budget Office has said is under the House Republican plan, the Ryan proposal, the total cost would increase. The total cost of providing care to people on Medicare would increase, primarily because it's more expensive to provide coverage to people under private plans. They also point out that the beneficiary share would double. So that's the $6,000 to $12,000. And finally, what this doesn't show, because this is 1 year, is the government share would be reduced considerably. So it's a very strong statement about how to slow the growth in government spending, and it would be effective in achieving that goal. The Congressional Budget Office points out, however, that it does so by shifting costs onto people on Medicare and by increasing total cost per person. This particular proposal caps the growth in government spending to inflation. So rather than say, for example, there's a lot of talk about myths. There's a lot of myths about how this is like a drug benefit or how this is like the federal employees benefit plan. Those plans, the government payments increase based on the total cost of providing benefits. So if the total cost of providing a defined benefit, the drug benefit goes up by 10% on average, the government payment goes up too. It rises. Under this proposal, the government share doesn't take into account how healthcare costs really rise. It just goes up by inflation. And that's why it's a real bite. That's why it's potentially a real bite on the amount that that beneficiaries have to pay. So if you go to the next slide, you can see, so we just looked at inflation compared to the growth in Medicare spending over time and the growth in the economy. All of these are kind of ideas that are out there for capping Medicare spending. You can see historically, that inflation was much, much lower than Medicare per capita spending from 1985 to 2009. And even projected, there are 2 points I want to make about the projections. You can see that Medicare spending is projected to grow pretty slowly, and that's largely due to the health reform law of 2010 that had significant Medicare savings. But even at these very low levels, if you cap the growth of inflation, you will be taking a pretty significant chunk out of Medicare spending in the future. Sort of the last broad idea I want to leave you with is there's some suggestion that rather than do specific proposals that can be easily understood and dissected, there might be some interest in doing broader caps on the program. And I guess the thought I want to leave you with is these are general ideas and they sound benign, but it's a good idea to understand what's really meant by these caps. A cap on the federal debt as a share of the economy might mean spending reductions. It also could be revenue increases, right? So that does not exclude revenues as it's constructed. But a cap on federal spending, depending on who's talking about it, really means government spending, and that's Medicare, Medicaid, Social Security. That could be framed that way. Others are talking about a cap on federal health care spending specifically, so that rules out other programs. And then some are talking about caps on Medicare spending. That's quite direct. A softer version of this is targets for Medicare spending, which may or may not have sort of the teeth behind it to achieve savings. So what's meant by these caps is important to understand. How they are implemented, really important to understand. And I guess the overarching cap that I didn't even put on here is the idea of a balanced budget for the federal government. And I know there's discussion about a balanced budget amendment. What that means, what it means for Medicare is obviously of significant importance to the Medicare population now and in the future. I think it's fair to say we've learned that Medicare is a really popular program. Kaiser does a lot of polling, others do polling. We asked people what they felt about potential savings in Medicare to to address the federal deficit. The public's not there. I think after the health reform debate, it was pretty clear that the public was skittish on Medicare savings. So it may be a good idea to do more to achieve savings in the Medicare program from a fiscal point of view, but it seems like it's a tough sell to the public at this point in time. If you go to the next slide, you can see, you ask people about their priorities. The blue segment there is no reductions. Again, the public is not particularly enthusiastic about cutting Medicare, so those that are wanting to see Medicare cuts in order to do something about Medicare sustainability or the debt or deficit may need to do some explaining in order to have public support at this time. So Medicare is way back on the public agenda. I think for those of you who are here during the health reform debate, it's almost hard to imagine that we'd be back so soon talking about Medicare savings, but here we are. I think as you are struggling with thinking about what are the best ways to move forward, I hope you'll think about the people who are covered by the program, what their experiences are today, and what their outlook is for the future.